Hi everyone. I think we're live. Say hello if you're there. um, yeah, we're going to be starting in a few minutes. Um, so let me know if you can hear, if there's any problem whatsoever um, with what you're hearing, or if you're seeing me. I clearly need a little more coffee. Um, but yeah, we'll get started in just a little bit. It's going to be an interesting live today because personally, this is one of the things that I've actually had a harder time wrapping my head around. The other one was the difference between food and skin allergies, which we tackled a few weeks ago in another live. So, yeah, this is another one. Irritant versus allergic reactions is something that has always. Jana, hi! It's good to see you again. But irritant and allergic reactions always kind of mess with my head a little bit. Hi, Keys. um, and every time, we talk to people about the difference between allergic and irritant reactions, I'm good until a certain point, and then I start doing this because they both require a certain amount of time to sort of build up to happening. But then once they happen, with an allergic reaction, it's immediate. It just sort of happens every single time, no matter the amount that you're exposed to that thing. Whereas an irritant reaction, as long as it stays an irritant reaction, you don't develop the sensitization to make it an allergy. It is highly dependent on how much of the thing that you use. So then I start getting tripped up because it gets a little complicated. Hi, Sarge. Oh my goodness, Suzanne! Everybody, if you're seeing Suzanne, she's an incredible esthetician in New York City. Just phenomenal. Find her on Instagram. Sunday Skincare NYC, I think, is her handle. Suzanne, put it down because put it in the comments. Suzanne is phenomenal. She's an esthetician that we work with, and she is just all about the goodness, spiritual, mental, health-wise, skin. She's phenomenal. Makeup. She's just awesome. So definitely follow Suzanne and ask her questions and everything because she's just phenomenal. So yay, I'm so happy to see you, Suzanne. Oh my goodness. Yes, there you go. Sunday Skincare NYC. Make sure you check her out. I love you too, my dear. But so she'll post about everything from skincare and health to like her cats and her hubby's music. She's just awesome. And recipes and just all things good. So yeah, I don't know. She's phenomenal. So yeah, we'll give it a few more minutes and then get started. I'm missing my co-host Gavin today because I think he's in class. Unless Gav, are you in class? Yeah. I don't get him. I don't get him today, or if I do, I get him much, much later. But yeah, it'll be an interesting topic today. And I think important. You decided what?
Huh?
You can't skip class.
No, I'm not.
Look at my hair.
It
It's still
just
so
ended.
wet. I didn't have time to.
It just ended.
Oh, it did. Come sit. Join us. Yay, I get my co-host back. Say hi to everybody.
Hello. So we're trying it at a new location.
We are. Well, actually, this is an old location that we stopped using because it had been raining, and then we had crickets that we were contending with.
Yeah.
Do you remember? Okay,
Like a
that's
bunch
more
of
like a crow.
But it's the same thing.
It's the same thing.
Same.
Crickets and crows are the same thing?
Yeah.
Okay. There's Nina. Say hi.
Hello.
Hi,
Hello,
everybody. Suzanne from New York is watching.
Hello.
So is Jana. Okay, so what do you think? Should we get started or wait another minute or two?
We should get started.
We
It's
should get
10:03
started?
already.
Right, and people aren't on time, then what? Then what?
You guys decide. Please comment. Do we do it?
Do we start? Do
Do
we
we
give it
start?
another minute? I say we start. It's because you and I are on time, right?
Yeah.
Are you on time?
No.
At least you're honest.
Yeah.
Okay, I think we can actually start now.
Okay,
So,
let's start.
welcome everybody to our Skin Sites on.
Wait, can they see us?
Yes.
Oh.
You guys can still see us, right? Yes, of
Yeah.
course.
Okay. So
So,
this
yeah.
is our skin sites on the
On.
different types of skin reactions. So like irritation and allergy.
There you go.
So yeah.
Exactly. So
Uh,
there really are quite a few different skin reactions. So it's kind of important to be able to break it down because,
And they really are different.
yeah, they really are different. But before we get to that, some
Remember
reminders.
to ask questions early so we can then answer them before the end.
Yeah. And especially for VMV related questions, if you can get those questions in early.
We have a higher chance of answering them.
Yeah, also when my mom is here, his grandmother, we really try to stay focused on skin questions because it would be a waste of a resource to not use her for that. So I really focus on the VMV questions. So get those in early if there's anything you want to ask me about VMV, and get your skin questions in early because I want to make sure we answer as many as we can during the live.
Yeah.
Also-
So don't forget to follow us on Facebook and Instagram at BNB Hypoallergenics.
Yes.
And also, please subscribe to our YouTube channel. It's also called BNB Hypoallergenics.
Yes,
so
indeed. And
please
click
subscribe. Notification bell.
yes, because we have a lot of content going up every week now, so you don't
Yeah.
want to miss that. And say hello. We want to know where you're watching from. Among other things, we've noticed that depending on where you are, we can include information that might be more relevant.
Relevant to like where you are. So just an example,
needs
if you're
coffee.
in Russia, it's cold.
For example.
So you might have different skin conditions than we do here in the Philippines because it's
Where
the
it's
tropics.
Right. But even here it's much cooler. But
Yeah.
you know what I mean. There are certain things that are more prevalent in certain areas. So definitely let us know where you are, and definitely let us know in the comments if there's anything else that you'd like us to cover in the future. So there.
Also, we have a surprise for our live stream viewers. We'll be
We
giving
do
away
today.
vouchers to our online store, just to anyone, randomly picked.
Viewers, though, definitely
Viewers.
people who. I'll take your rain and crickets if you take the snow. You know what? The first day of snow I'll take, Jana. The week after you can have, but yeah, no, I know it's been crazy weather-wise. Okay, so getting into our topic for today.
So a very common thing we hear from our clients and patients is, "I don't use that product because,"
It made me break out.
or "it gave me acne,"
Right.
or "it gave me a rash," or "it darkened my skin."
Right. All of which might be the case or might not be, right? I'm actually really psyched about today because we're finally going to be able to break it down. For those who were here really early, I was mentioning that skin reactions can be far more complex than you think. Certainly, I've struggled in the past. There have been two main topics, I think, where I've really had a hard time, and I don't know why, but my brain's just had a hard time wrapping around the concept. And the two topics have been the difference between allergic reactions of the skin and like dander and food and pollen and things like that. And we did do a live stream several weeks ago about that. Excuse me. So I finally, got to really sort of break that down. The other is skin reactions because they are really quite different. Just the difference between an allergic and an irritant reaction alone can be quite complicated. So I'm really psyched that my mom is going to be here to discuss that.
I need to go really soon.
Okay, he has to go back to class. Do you want to say goodbye to people?
Yes, goodbye everyone.
Okay.
I wish my teacher would just like allow for like an hour of.
Your teacher would allow you to be on a live stream?
Yeah, I wish they like changed my lunchtime to this time
Okay.
so that I could actually see you guys.
Well, why don't you bring that up with her and
Bye.
see what she says? Okay. So anyway, for now, what I can share before my mom comes in and really helps us understand the differences between skin reactions, it's far more unlikely than you might think for the last product you use to be the cause of whatever reaction that you have, be it a rash or acne or whatever. And I find it's still a common misconception that the very last thing I used is the one that broke me out, is the one that gave me a rash. It's actually much more unlikely than likely than that's the case. We discussed this several weeks ago in that live stream between food and skin allergies. Most allergic skin reactions, scratch that, allergic skin reactions are type 4 reactions, which means they take time, right? Type 1 reactions, which is food can be several things, but a lot of food, dander, pollen, they're IgE mediated. We have IgE in our bodies, so when we react to those things, those allergic reactions are very quick. It's a very direct pathway. So within 60 minutes, for sure, you're going to have a reaction of some sort. Some things can be delayed, but it's quick. It's very quick. Type 4 reactions, which are what skin is, you really need time for sensitization to occur. So it takes much, much longer. Acne from a product also doesn't happen overnight. It usually needs some time for the comedone to get clogged. So it's constant use and the constant clogging that kind of leads to that. If it's acne because of an allergen, which is an acnegen, right? It irritates the pore, causes inflammation and an acne. That takes time as well, because it's not strictly an allergic reaction. It is an inflammation over time that then can lead to infection. So for a skin reaction, very frequently, it's actually something, you know, let's say I've been using this product 2 days, I get a reaction. It's probably not that. It might be something you've been using actually for quite a while. Sometimes weeks, sometimes several weeks, sometimes years, where you've finally developed a sensitization to it, and your cells have now been like, no, now that's an allergic reaction, we don't like it. Or in the case of an irritant reaction, you finally get to a threshold, right? So irritant reactions are highly dependent on the concentration, how much of the thing you're actually exposed to. So for example, with alcohol, topical alcohol that we're so familiar with now because of the pandemic, it's actually not an allergen. Alcohol with fragrance in it, the fragrance is the allergen, but the alcohol itself is just an irritant. And like irritants, it really depends on the amount of exposure that we have to it. Then we get to a threshold and then we experience reactions. So why we're seeing so much now of hand dermatitis, from hand washing, from disinfecting, is in part because we're getting so much more exposure to alcohol, which is an irritant. So there, interesting stuff. So we've seen this again and again in patch tests when we'll have a patient or a customer who comes in and says, oh, I'm here because I'm allergic to this. And then we'll do a patch test, and it's actually the product that they thought was the problem they have no reaction to, but it's other stuff, other ingredients in products that they've been using for years even, that's the problem. So that's why when we formulate at VMV, we really try to think of reducing the risk of as many skin reactions as we can. So the VH rating system, for example, I'm going to see what you'll be able to see best in this light. Let's see, hopefully it'll be this. Yeah, you can see there you go, perfect. The VH rating system is here where you see the number right there. One of the important things about that is that we base it on top contact allergens that are regularly published by leading contact dermatitis groups, and it's coming from over 20,000 patch test results. So it's a nice, good size. And by omitting as many of those as possible from the formulation, we significantly reduce the risk of allergic reactions. By not using irritants, or by using them in very controlled concentrations, we then reduce the risk of irritant reactions. Superwash, actually, if you look here, Superwash does not have SLS, right? But it does have SLES. SLS and SLES are phenomenal coconut-derived surfactants. They're not allergens, but they are irritants. SLES much less, which is why we tend to use it. And like all irritants, it's very dependent on concentration. So we use it in a very low amount. In COVID, it's actually very good to use an SLS or SLES for added microbial protection. But we also have SLES-free stuff as well, if that's what you're looking for. Point is, we really are trying to avoid as many types of skin reactions as possible. Then by not using comedogens, then by not using allergens, which can be acnegens, we lessen the risk of acne as a reaction. And what further helps along in terms of reducing the risk of different reactions, other best practices, we use fairly big particles, molecule sizes. In hypoallergenicity, a best practice is to keep things large. The smaller the particle, the higher the risk of an allergic reaction. So we don't use nanoparticles, for example. the fewer ingredients, the better. So we're very specific about what we do use and doing our own manufacturing. So we know exactly what goes in the product and how the product is stored, and even what's in the raw material of the ingredients. There's a lot more control there. So you can shop all of our products at vmvhypoallergenics.com in the United States, vmvhypoallergenics.ph in the Philippines. Sorry, vmvhypoallergenics.com also ships around the world, so check it out. Most of our products have the organic, clinically published virgin coconut oil and monolaurin that everyone loves. And everything is VH rated, so you can really quickly see what you can use. Again, as Gavin mentioned earlier, we do have a surprise for our live stream viewers that you can use online, so stay tuned till the end. In the US right now, we still have a great special on our Re-Everything Eye Serum, which everyone loves. If you shop one, you get the second as your free gift. And then if you go to our Glowing Gone section, we have a bunch of favorite products that are on sale at like 50% off because they're reaching their sell-by date. And we have a great article on vmvinskin.com about expirations in cosmetics because they're not food. They keep rather well for years even, but we can't sell them, like put them on a ship, which takes months to sell abroad anyway. Point is, it's a great special that's on right now. In the Philippines, we have a shop one and get a free gift of the same thing for our lipsticks and lip glosses, which is awesome. And that's online at vmvhypoallergenics.ph, and in our boutiques you get a free lipstick with a qualified purchase. And in our VMB Skin Research Center and clinics, they have a special Stay Safe bundle, which is 2 super washes of 250 ml plus the monolaurin pellets, which everyone loves to stay safe, which I'm actually downing now because we've had sickness in the household, and a large Noad oil. So check all that out. And then the last thing I'll say before I call in my mom is, yes, if you are interested in a teleconsultation with her or a nutritionist or doctor we work with, drop us a PM. And don't forget, if you've had a patch test, you can share your results with us and we can help customize recommendations for you based specifically on your allergens. So the last thing that I'm going to mention, I'm going to call my mom in, is if you have had dryness, acne, redness, flaking, or other skin issues that just do not seem to go away, do ask your doctor about a patch test. In the United States, contactderm.org, you can search by your zip code, but there's so many allergists now that are also doing patch tests, and they work closely with dermatologists too. And in the Philippines, drop us a PM and we can help make that happen, because patch tests can be fairly miraculous at clearing things up that you just couldn't clear before. Instead of spending so much money on random trial and error, patch tests are the way to go. So now, to help us better understand what the different skin reactions are and what they mean, I'm going to call on my mom, Dr. Vermen Viralio Rowell, who is our founding dermatopathologist.
Hello there.
Hi.
Hi.
Sorry. Have a seat. It was such a pretty day, I figured let's be
It
outside.
is lovely, right?
Okay.
It
There you
is so
go.
beautiful.
We're looking
today.
there.
Hi.
Hi, everybody.
Hello, everyone.
Okay, so a multi-published expert in contact dermatitis, Dr. Viralio Rowell is also a dermatopathologist, meaning she examines the biopsies. If you've ever had a biopsy done, they take like a tissue sample. She's the specialist who would look at those tissue samples under a microscope. And I find this a really interesting perspective to get a deeper understanding of different skin conditions and reactions, plus her decades of experience as a clinician, researcher, lecturer, teacher, blah, 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 makes her an awesome resource expert for our topic today.
Okay.
So say hi,
All
Mom.
right. Hi.
Hi. Hi, everybody.
Yes.
So yeah,
Good
okay.
morning, world. What a beautiful day it is.
It is, except poor Jenna stuck in the snow, I heard, so.
Oh, yeah? Okay.
Okay, we'll send warm vibes.
Yes.
So I kind of went through a little bit of a laundry list, and I figured maybe we could help people understand different skin reactions first by doing just a quick list without a lot of detail. What are the different type of skin reactions?
That are relevant to the subject here would be red little spots. You know, you call them little macules if they're flat and you can't feel them. Is that what you mean? And if you can feel
yeah,
them,
that's
they're
exactly
what
what
we
I mean.
call
Sorry,
papules.
again, which one is this?
Macules are those little flat little red spots.
Okay, wait. So let's back up. The first type of skin reaction is
A macule.
a macule. This is new to me too. What is a macule?
That's a little spot on your skin that doesn't feel. You don't feel anything at all. It's just a flat, but it should change from. Here's a good macule. There.
Macume or macule?
Macule.
If you put your hand up there, they can see it better. Can you?
Let me give you a good macule. I have
I've
lots
never heard
of
this word before. I'm kind of.
macule. So these are macules. Here, that's a good example.
Hold your hand up there. They can see it.
A little spot.
You'd have to stand up and go over there.
Yeah. Anyway, it's a little spot
Would
on
that
your
be one?
skin. Yeah.
Okay.
Go.
Here you go. I don't know if you can see that right there.
There you go.
That
That's a
spot,
macule.
That's a macule.
But more or less, sometimes it's red, but it's just flat on the skin. You don't feel anything. It's just flat. And many of those are really just freckles.
And that's a reaction?
That's a reaction to oxidative stress.
Okay.
That's one of the changes from, here I am at 81, so I'm developing many of these little macules, little spots that are dark on the skin. Okay, here, I have lots of them. Okay, macules. Here, can you see those little macules
Yep,
that I have? Well,
perfect.
those are macules.
Okay.
And you may think they're just simple freckles, and it's because you're fair or you're a little bit on the brownish side, sort of thing.
So
But they
oxidative-
actually develop as you grow older
Okay.
because of oxidative changes in your skin from aging by itself or from what are now known as exposomes, which are the things in the
Okay.
in the environment.
So
etc.
that kind of reaction is something that happens over time because
Yes.
it's age-related exposure to stuff around us, what
Correct.
we eat, our lifestyle, stress,
Yes.
etc. Okay.
Yes.
So what else is another type of skin reaction?
Papule.
Papule.
That's the one that is also a macule that has become elevated.
Macules and papules.
So
Okay. So a papule is what?
it's a little
Papule I've heard,
elevated. A
not a
good
macule.
example is a very tiny bite. It is now a papule because you can feel it. Or a tiny little pimple. It's a papule because
Which is different from a keloid, which is a scar.
a keloid is a scar. And there are many kinds of scars also. You don't want to go
Fascinating.
into that.
No, we won't get into that now. But so a macule is sort of a flat mark.
Yes.
A papule has a slight raise to it.
Right.
These things take time. They're not immediate reactions to something that you
Oh,
use.
it depends upon the cause. If it's a bite, boom, and you get a papule. within-
Okay. Holy moly. And that's not post-inflammatory hyperpigmentation either.
That is the one that takes a while. You get a redness now, either from a macule or a papule or a bull or a bigger one or a blister actually or
Okay, this is a lot more than
or
I
a
bargained
patch or
for.
a plaque or what, and then you have discoloration of the skin after all of that. That's called post-inflammatory.
Hyperpigmentation.
Hyperpigmentation.
Let's see if I can back up a little bit here. The more common things that we might encounter, lay people, right, would be things like an allergic reaction. Correct?
Yes,
to
and that's
something.
what
Okay.
you call a rash.
Right.
But when
Okay.
we look at a skin change, we don't call it a rash. Or if you have a dermatologist who calls your lesions rashes, you can run away.
No, maybe they just need a little bit of coffee. God, no, they're having a moment, or maybe they're just trying to simplify things for you because everyone
Correct.
understands rash.
There you go.
There you go. So if you have an allergic reaction, that's usually a rash. So that's redness or maybe itching, right? Some
Yes.
burning, etc. An allergic reaction, I was just explaining, doesn't necessarily happen this quickly to something, especially something you've never used before, right?
Yeah.
So if I apply a cream
Yes.
and I get an immediate redness to it, what would that be?
Probably an irritant reaction. You got irritated from something that was there. You were not really allergic. When I came in, I overheard Laura talk about the sodium lauryl sulfate, which is a very good ingredient in washes. And many times people think it's an allergen, but most of the time, many of the studies have shown that it's really more of an irritant until you go, it's more of an irritant than an allergen. so
Okay,
that
I'm going
you
to
can
have to
get
back up
reddish.
because this is exactly what I was sharing with people earlier. This is one of the things that really trips me up because I know that irritant reactions are dependent on concentration or hitting a threshold
Correct.
of exposure, right? But you just said it can happen immediately.
The irritant reaction?
Yeah.
Oh my God. Let's see. Depending upon the strength of the chemical.
Oh, I think I
Terp-
understood it. Okay,
Yeah.
go. I think I understand.
Yeah, so it's not just, you know,
Okay.
the duration or the amount. It's
the
the
concentration and the
strength, the
strength.
power of that chemical, you know.
To begin with,
To start
regardless of the amount. Okay, I think I have it. Correct me if I'm wrong.
Okay.
So, my understanding now of an irritant
Especially with the
reaction-
chemicals that are being used by you guys
Right.
in the
You guys. As
by
if
us.
you don't. Okay. So anyway, for an irritant reaction, right? Something the example I gave earlier was like SLS or alcohol. So fairly mild irritants, right? Except let's say for something like alcohol, the more you use it, you really do start to hit a threshold, right? Once you hit that threshold, the reaction is immediate. It's flaking, dryness, redness, all of this stuff.
or it's cumulative, so that
Cumulative till you hit a threshold.
because the barrier gets compromised.
Okay.
Yes.
But if you're talking about an irritant like chlorine or turpentine or some acid like sulfuric acid,
Hydrochloric
acid,
yeah.
right?
Right, there you
They're
go.
very caustic, very
There.
powerful irritants.
So the effect
For
is
something
immediate.
like that, the effect would be immediate, not because it's an allergic reaction,
So really-
but because the strength is so much, the strength of the irritant is so much that you hit the threshold so quickly
And you get a burn.
and you can get a burn. Okay, so that's an irritant reaction. It is very dependent. But here's the thing, sorry, key to me with the irritant reaction, and correct me if I'm wrong. Let's say that you are now very dry, itchy, flaky, etc., because of the chlorine and alcohol exposure, right? If you stop that for a while, weeks and months, the next time you use the alcohol, you may not react
Correct.
because you need to hit the threshold again to get
right.
the irritant reaction. That's different from an allergic reaction. If
yes.
you develop an allergy to something, even if you stop it for 5 years, or let's say if you stop it for a few months, the next time you're exposed to it, regardless of how much you're exposed to it, you will react, correct?
Yes,
Okay.
right.
So far, is that clear? Can you folks let me know in the comments if that is clear? An irritant reaction, you have to hit a threshold in order to react. Some really powerful things, that threshold is very quick.
Right.
But if you stop for a while and you are exposed to it again, you may not get the reaction until you hit the threshold again,
Right.
right? So that's irritant. Let me know if that's clear.
Correct.
For an allergic reaction though, you can be using something like ilang-ilang, right? For years or for months or whatever, and actually be okay with it until your skin is sensitized and you develop an allergy to it.
Right. And every time you use any perfume with ilang-ilang in it, you're going to react.
Right. So from thenceforth, that's not a word. From then onwards, henceforth, from that point onward, any time that you're exposed to ilang-ilang, regardless of a drop or a bathtub, you will get an allergic
Best
reaction.
example is for you with poison ivy allergy. Anytime you go out there and get exposed to the plant, you'll get a reaction.
Okay.
Even though you haven't been there for a couple of years or
Right.
decades.
So is that clear? Do you guys kind of get it? Because like I said, it's taken me years to kind of get to this point. So thank you.
Explain to them though why that's so important
About knowing what?
to recognize about an allergy and irritancy.
Why is it so important? Why don't you tell them?
Well, because when you go to your dermatologist and ask them about certain products that you're using, and you say, "I just got this bottle, and boy, did I react to it," that makes me pause because by nature, the people who make products for you to use on your skin, whatever the indication, we tend to really make products that are very safe for you, So when you put it on for the first time, it's kind of unusual for us to hear that you really reacted to it seriously.
Because it's a
of course-
regulated industry. That's what we
Right.
have to keep reminding people.
That's
We're
right.
not allowed to put in toxins. That just can't happen. It's really rare to get
Yeah.
it by an FDA.
Right.
It is highly regulated.
Unless,
even-
of course, you know certain ingredients you're allergic to, like balsam of Peru,
Ilang-ilang.
ilang,
Right, and you
the
use it.
perfumes, the cinnamaids, and all of that. Nickel, rubber, and you applied it with a rubber sponge, and you put it on, and there was fragrance in it. So,
Okay.
well, then you'd get an immediate reaction simply because the allergens that you're allergic to are in there.
Right. So quickly though, I just want to make sure. Thank you, Suzanne and Sarge. I'm glad that was clear. And hi, Jay. We used to work together. How fast? Sarge is asking. How fast does your skin react to a certain product if it is considered irritant versus if you're allergic to it? Taking a stab at that, it depends on the irritant that's in it. So if you're not allergic,
Very good.
so it's taken years. If you're not allergic to it and it's an irritant, it depends how much of the irritant is in there and how often you use the product. So you might not notice anything for a long, long time until you hit a threshold of the irritant, in which case, if you stop using it and you use it again, you'll be fine. But if you develop a sensitization, if you actually develop an allergy
Right.
to it, henceforth, right, from that point onward, even a smidge of it, 10 years from, well, several months from now, you will react. I keep correcting myself when I say years because allergies can change, right?
Yes, that's
Right.
it's true. It seems the body is capable of being able to dull its reaction to certain chemicals if you haven't been exposed to it for quite a while.
Right. So if you haven't had a patch test in a decade, it might be a good time to get
Repeat
one
it.
again. Exactly.
Absolutely, yes.
Okay, so
As a matter of fact, I tend to, nowadays especially, it seems the chemistry of the air now is so bad and the exposures and all
different.
that. So that, different. So that when I do patch testing nowadays, I'm getting so much of what we call this angry back. I mean, there are just so many positives. And I tell patients, this is just too many positives. It just means you have an angry back, is what we call it. And so I teach them that let's just stop all of these products first. Let's go on a fast. Let's use very few and simple products for now, for the next at least 2, 3, 4, 6 months even, depending upon your irritancy or allergenicity. And then, as I tell them, by that time, your angriness of your skin will have come down sufficiently so we will be able to repeat your patch test.
And see better.
And when I do, it's really amazing at how only
Yeah.
2 or 3 very good positive
Right.
reactions will come out and say, okay, so you're not, don't worry, you're not that bad. I mean, it's really just these that you really
You
have to
really
avoid.
aren't. I mean, if Suzanne is still here, she's an esthetician in New York. You can really check her out, and she's seen as many people as we have who are allergic to everything and are just miserable. And a lot of times it's just let's lessen. Let's do a skin fast and let's start from scratch. And it's amazing how much easier everything is. So again, just making sure we cover everything because we have some phenomenal questions coming in. But so we have an allergic reaction, we have an irritant reaction, and then what about urticaria?
Yes, there is such a thing as contact urticaria.
Okay.
And there's urticaria, which is a spontaneous appearance of these little things, spots that are bumpy.
Do y'all know what
red.
urticaria is?
Urticaria
Yeah.
are also commonly called hives. Okay, and what they are they are like bite-like little spots that in some people will expand and become map-like, and in some will become coalescent and really big. So they have to go to the emergency room because they're swollen and red
So
like that.
urticaria is
It's
not,
urticarial
when we
reaction.
say rash, that's not the same thing. Urticaria is a very specific, if you've ever had urticaria, you know exactly what we're talking about. They're mounds. They're really raised, and sometimes you look like an atlas. You look like you have these map-like segments of raised skin, and they're really itchy or really painful.
That's right.
Either, but they're no joke, okay? It's not just a rash. For contact urticaria, what would that be? Is that a severe allergic reaction to something? Because urticaria sounds more like a type 1 reaction, doesn't it?
Yes. Urticaria is a type 1 reaction. That's why reactions that are what we call urticarial occur usually within 1 hour after eating or drinking or
Okay.
applying or whatever something on your skin. But contact urticaria is different.
Yeah, what is that?
It's different in the sense that some of it may be an irritancy and some of it may be an allergen. on the skin, right? Right. So it is one of those things that we, because then it also leads to something called this sensitive skin syndrome.
We did a live stream on that too.
Yeah.
Check it out. It's really
Check out the
interesting.
sensitive skin syndrome and the contact urticaria.
Okay.
They're in the middle area, which
So-
is can be an allergen, can be an irritant. You know, depends upon how it evolves, how it comes on.
But
and
it is
where-
a type 1 reaction. I
to
think
the
that's-
most part it is.
yeah.
Yeah.
I think that's key because I think people should know it would not be all that common for you to apply a skincare product and get contact urticaria. It's not that common.
Right.
It really is quite, I mean, you hear her talking about it. It's like, it's kind of a funky duck, right? But urticaria is one of those reactions really associated with things like other type 1 reactions, anaphylaxis,
Right.
puffing up, right?
Angioedema,
Angioedema, puffing up, swollen.
difficulty in breathing.
Exactly. So an urticaria is not a simple sort of type 4 skin reaction the way most T cell type 4
Mediated
reactions
ones.
are. T cell mediated reactions are type 4. That's contact dermatitis. That's the normal thing. If you're experiencing a contact urticaria, it's much more complex. It could be something you applied, but it could also be something you ate, right?
Yes.
Or something you drank.
Right.
That might actually be where my brain would go first. It would be more unlikely for you to get an urticaria from something you apply. Not impossible, but rarer than a contact dermatitis. Clear-ish? Okay, so that's urticaria, allergic reaction, irritant reaction, tissue swelling. Yes, exactly, Suzanne.
And then we go from those into little spots appearing on that macule papule thing, which could be the start of an eczema.
There you go.
An eczema is a broad name. By the way, eczema is a non-specific
It's
term.
descriptive.
Yeah, it's a
yeah.
description.
That bubbling,
right.
then crusting over. That's eczematus,
Right.
right? It's not a
In some
skin
parts of the
condition.
world, they
Yeah.
call atopic dermatitis eczema.
Yeah.
But just
Or eczema.
or eczema,
in the UK.
right? But just to be clearer about it, the way we describe an eczematous disease is that it appears as a little red spot, a macule maybe, then it becomes a papule, maybe even a little bit elevated, like swollen, like like an urticaria, but then it has its own what do you call this way of developing into little tiny bubbles.
Right.
Then they become a little bit oozy and wet like that.
Then they crust.
And then they go into a dryness phase, a crust, and then you pick at it because it's so bloody
Right.
itchy.
Okay, but I'm not
That's
getting
it.
into that because we have a whole bunch of things on eczema another time, but I want to make sure we cover the types of skin reactions, right?
Okay.
That's why we're here. So allergic, irritant, we have urticarial, which is more rare.
Okay.
We do have macules and papules.
And patches.
What's interesting to me about those is that they don't seem, because they're so not immediate and they're not acute, right? When you get a macule or a papule, you might just dismiss it, as she said, as sign of aging. Oh, it's just a spot. Oh, it's just a mancha in Spanish, just a stain,
Yeah.
right? When it actually could already be a reaction to oxidative stress, sun damage, poor diet, stress, etc. Right?
Right.
So it is more long term, but it's an early warning
Yes.
sign.
It's an early warning sign that there is stress in the skin. Like I always tell a lot of patients, how are you doing stress-wise? I'm okay. I'm dealing with this thing. I say, okay. But your skin is complaining.
Yeah. You say you're fine, but you really do have to listen to your body. It's actually a lot of new therapy is about that. EMDR and all that is what you say is different from how your body is, what your body's actually telling you, right? Different topic. Okay, so another reaction.
We should talk
acne.
about that one
We
day.
should.
The manifestations of stress on the skin.
We talked about skin and stress, but anyway, we'll discuss this later. So acne. Is acne a reaction?
Acne is now considered an inflammatory disease. In other words, there's inflammation inside the body actually that is triggering the acne. All of it, from the adolescent type, starts with the hormones, internal is the
So
cause.
I mentioned
Then it manifests in the skin. The skin is just a fantastic mirror of what's going
Right.
on inside your body.
But so when people say, for example, I don't use that product because I react to it, I get acne. What does that really mean to you as a doctor
Okay.
when you hear that?
It depends. There are certain ingredients in cosmetics that are what we call comedogenic.
Right.
In other words,
Big
they actually, over time of using a certain product, very, very slowly, gradually, produce a thickening at the pore so that, you know,
A comedone.
a comedone appears, and then the inflammation occurs, and then you get acne. It's a gradual process of
That's the
development.
thing. That's what I want to also, I guess, help people with. We do hear clients or patients who say, oh, I used that and the next day I had acne.
No, that's not due to your product.
Right. That's not a reaction from the product.
The
because-
acne evolves.
Right. It takes time to get that clogging to happen. Is over time, as she mentioned, it has to build up. And then you get that comedone happening. And then if there's also inflammation and infection, then you have acne.
That's for
Right.
comedogenicity. We're talking about the evolution of a comedone, a whitehead, a blackhead, pimple
Right.
from the products you're using. However, you must also recognize that there is, besides that, there's a folliculitis that can occur in the skin. And I'm seeing a lot of folliculitis nowadays. That's really not even acne. Many times when you see little papules, you think of acne on the face.
Yeah.
A lot of the patients I'm seeing now is not real pimple only. There's folliculitis, and when they're very persistent and staying there, I tend to ask them to come over so we can do a scraping, look for fungus, or even sometimes we look for mites in them.
Yeah.
And then
Yeah.
when there's really definitely pussy, we'll send it to the laboratory. Lo
I-
and behold,
yeah.
I get to see all sorts of crazy
So I
organisms
think we should
in it.
do actually another live stream, but not just on acne, because we've done a part 1, part 2 on acne. I wonder if we should do funky acne, like different acne that you don't expect.
Yes.
Because she's seeing some
Absolutely.
wild things during the pandemic. So we'll probably
Yeah.
do that. But so in terms of reactions, acne isn't per se a reaction. Acne is an inflammatory condition. Can a product cause acne or cause comedones? Yes, but it wouldn't be an immediate thing. It has to
Evolves.
evolve, right? So I hope that kind of gives a good spectrum of the different types of skin reaction. She mentioned also earlier quickly, if you get a reaction or a bite or acne, a further reaction that can happen after that is post-inflammatory hyperpigmentation.
So common.
Very common, right? But so getting to some of these questions, because we're running out of time and they're important questions.
Okay.
From-
Can I just
Sure.
So regarding the post-inflammatory hyperpigmentation, whenever there are dark spots on your skin, right, and you've had some redness, some macule-papule
Mites,
patch, or
Suzanne.
eczema before that, that's what we call a post-inflammatory hyperpigmentation, right? There was inflammation, so you have post. You must remember then that there is also discoloration in the skin that just sort of gradually appears. No
Okay.
redness, no itching prior to it.
Right. That is also a reaction
That's also another
over
reaction.
time. And it could be to your underwear, could be to your laundry
On the face, it's
detergent.
melasma.
It could be from your gadget at home, etc. So again, I don't want to get too much into that. We do have live streams covering that. We can talk about that another time.
Okay.
But let me get to the questions. From Anne first. I think we discussed this. How long do you need, oh no, we didn't. How long do you need to test a specific product before adding a new product to your routine to make sure you identify which is the culprit?
Okay, so the question is, I have a new product.
I'm kind of testing it.
To start with, I love the thinking here already, that I will not place one after the other, just like that, but to actually test it out. This is wonderful because this is the message I always like to carry out, to bring to you guys, is that don't keep applying one product after another, get another one. Yes, this is a great idea of asking first, okay, how long will I use this product before I begin to
Right.
react to it? If you're using you're looking at the labels in the back, they look rather safe.
You're being guided by your
Y-
patch
yeah,
test,
y-
all of this. Yeah.
Right. Then about a week or two that's sufficient. About a week or two should be sufficient.
So
for you to
before, this
decide.
is interesting how this evolves, because historically we'd say, apply a bit of it like on the inside of your elbow. What is this called again? I never remember. The inside of your elbow.
the crook,
No.
the antecubital space.
Thank you. The crook I could figure out, the antecubital space. If you put a little dot of something there and you leave it on for several hours, or 24 hours, or 48 hours, and then you see if it's okay. then normally you should know. If you want to be extra careful, we've been told 3 days. Wait at least 3 days in between before trying another product. But if you really have a history, you might want to do this for about a week, even 2, just to be sure, right?
Sometimes I tell them to apply them here in the back of the ear, closer
Right.
to the face, to see, because sometimes also it depends upon the areas of your body. There are certain areas of the body that are much more reactive
And that
to
would be
this.
one of them.
Face, of course.
Okay, a next one from Hannah. How do I know if the reaction I'm experiencing is a purging or breakouts? So
What do
I
you mean
think
by
this might be coming from, like, for example, if you use salicylic acid, salicylic acid being the beta hydroxy acid, it's the only one, is known for being oil soluble. So it can penetrate the oiliest areas best, and that's usually the pores' inner walls. So it can do the micro
so then you're
exfoliation that
saying
everyone loves there at that level, which means it brings up all the gunk that's there, the debris, the pore cloggers, basically, right? And it's a purging that the longer you use the salicylic acid, that level of exfoliation is more consistent, so there's less stuff to bring up, right? So how do you know if it's that, or if it's, say, because of comedogens in the formulation? I think you have to look at the ingredients.
No. Okay, you're using salicylic acid, a product that contains salicylic acid,
Right.
for whiteheads and blackheads that you would like to come
Correct.
out and dry up and get out. That should occur within a week.
Right. Fairly quick.
If you then, as you continue that product, then you develop
New ones.
new ones towards the
Ah.
second and then the third week and all of that. Then you'll have to start thinking about it as being comedogenic for you.
Right. Either there are comedogenic ingredients in that product,
Mhm.
or you're using other stuff
Right.
that's clogging the pores.
Right.
Hope that's helpful.
So such that the salicylic acid is, gives up and says, I really can't handle all of those things anymore.
Yeah. We have a phenomenal, I know Jana said maybe this is for another live, but it's such a good question. Since it's possible to have a reaction with some of the tissue inside of our bodies, like the esophagus and stomach, especially if someone continuously keeps exposing themselves to an allergen. For example, because they're eating food off of plates and pans that are being washed with dish soap that contains an ingredient that's an allergen, how does that contribute to other GI issues such as GERD, erosions, and ulcers?
On the GI tract, I'm not an expert at all. But there is, the GI tract and the skin are kind of the same.
Yeah, very similar.
You
There
know,
are
in the way
some-
they
yeah.
evolved, the way they are made, they are actually both externals as well as the gut, because
And here's a
the embryo went.
follow-up question to that. Is there a way...
We'll
sorry,
answer that another time.
Yeah, but it's a great question. I really wanted to make sure I got it out there. Is
Because
there a
lots
way,
of people are into that
if an
nowadays.
upper endoscopy was done, that a physician could determine if the irritation was due to an allergen, a GI issue, or a combination of allergen and GI issue? So,
How do they do
what
that?
would be an interesting question for me? We'll look it up because I think that's a really fabulous topic. We can talk about the skin as well as internal interactions, potential ones. But one of the things that I'd be interesting to know is how much of the allergen even survives consumption, the acids, etc., long enough to make an impact on the lining of the esophagus or the GI tract, etc. But Jana, you're right. We won't be able to answer that tonight, only because we'll need more research onto that. But I think it's a great.
It might be a good
question.
idea. I would like to have a live stream where we have somebody who's into that
Endo
and together
GI.
with me.
Can be. Let's
know?
ask Doctor, what's his name? Maybe
Yeah.
Olympia. No?
Yeah.
We'll make that happen. I think it's a great question. Furthermore, I will do the research after this and at least have some answer within the week.
Right.
She has another question, which is, would Stevens-Johnson syndrome be considered an irritant reaction or allergic?
Allergic.
Allergic. There you go.
Yeah.
Okay. All right. So I think we got most of the difficult questions in. So in
Let
terms...
me explain Stevens-Johnson.
Okay, go ahead.
Stevens-Johnson syndrome is characterized with the development of blisters on the skin, and but the interesting thing about it is that it can be a reaction to a drug. So we have a lot of Stevens-Johnson secondary to medications for depression and things like that, or antibiotics. As I know whatever. But you can also have it from herpes simplex, from a viral infection inside. So it's a very severe reaction that occurs into the skin. And what the question then is it an allergy? Basically, it's an allergic reaction to some of the chemicals that are being produced. And what's interesting nowadays is that we, in the world of medicine, because of all the molecular changes that we are looking at now, we're looking now at the type 1 and the type 4 reactions and the in-between reactions of toxicity and whatever. They're kind of interrelated and they can coexist and all. So it will really depend upon the kind of thing that is causing the Stevens-Johnsons. And then, as the person who was asking me these questions is probably knowledgeable about the fact that there are so many other new and different kinds of skin changes. There's the dress, then there's the baboon. These are all generalized kind of reactions, sometimes just to a drug, and other times to other things that you've taken inside into the body.
Yeah, we'll need another hour.
Yeah.
This is a lot, but important. So thank you again for that question. It's awesome. What I did want to make sure, because I forgot, is the acneiform reaction. What is that? Because it's not acne.
Yes.
It's acneiform.
They really look like acne. A good example is the sweat acne that you get in the back of the, in people who perspire a lot. They tend to get little pimples, and then they get scattered, and they get more of them in the back, in the chest, sometimes along the flow line of your sweat, along in the back as well. That is a folliculitis and not really acne, and that's why it's acneiform.
Yeah.
Another acneiform would be from drugs. Acneiform reactions to anti-TB medications is quite common. Those are also drug reactions, but they look like acne. Right? So
My face is because there are just so many great questions, and I just want to make sure we get to most of them. Okay. I'm going to try to see if I can smush some of them together. Okay, when do I need to see a dermatologist or go to an emergency room? Is there some type of leveling, like, okay, if I get a simple rash at home versus I get urticaria versus I get blisters, when do I know if it's something I can sort of handle at home, and maybe we can share some first aid tips, or something I really need to call my dermatologist, or I need to go to the emergency room? What are some key things to look for?
Okay, the first thing to remember is that I am such a believer in do something immediately. Okay. In other words, when I first see a little spot, a little red spot on my grandchild's skin, for instance, around here, I'll ask immediately what happened there. And depending upon what I think, whether it was just a chemical from the outside, whether it was a spot that got there, whether it was an insect bite or a bite from a dengue mosquito, whatever, hopefully not, I'll get a cream that is against innate immunity. Because the very first thing that occurs in an irritated skin, in irritable skin, is the innate immunity. That means the anti-inflammatory chemicals that are already existing within the skin will react to it. And so therefore you bring it down to a level that's...
Is IgE innate immunity?
IgE is immediate reaction. It's not immediate immunity.
There's so much. We won't get into that. It's really a whole thing. Okay. So do something immediately, which is, for example, I'm a big fan of ice. So if there's itching, I'll probably reach for ice, or redness. I'll reach for ice right away. If you have a topical steroid, that can be helpful. But again, we really try to caution people, because a topical steroid is not for daily, long-term use like a moisturizer. It really is for an emergency, right? If you have one lying around, that's fine. But ideally, don't self-medicate with that stuff. If you know you have a certain condition, you might have an antihistamine that you've been prescribed. That might be something to take. When to go to the emergency room would be, because I know she sent patients to the emergency room where the reaction is really spreading very quickly and becoming very acute. What would people look for to judge, okay, we got to go to the emergency room, or urgent care?
I remember sending some. I was in Maine, and somebody called me up and said, I have a little spot, whatever. The beauty now is that we're getting so used to having pictures taken, and the patients are very good at taking pictures of their spots. They send it to me, and what I will say is, okay, try this and take this, and then send me another picture within another hour or so. And if it has expanded already and it's kind of big, and then you say, it's kind of a lot already, and
Time
it's,
to go.
Yeah, time to go.
Clearly,
to the
if you're
emergency
experiencing anaphylaxis, if this is something you deal with anyway, you've already been told how to use your EpiPen, etc. What I think is a good takeaway also from what she's saying is, because of COVID, one of the upsides is people have become
Yes.
far more comfortable with telemedicine or digital medicine. So in the United States, I know there's actually quite a few of even urgent care that you can text or tweet or get online. In the Philippines and other countries, I know it's becoming more common, like she said, to send your doctor a photo to help guide you. But certainly if there's something that's becoming intolerable, pain, itch, and that is spreading, or if you're also having like difficulty breathing and severe swelling, it might be time to go seek urgent care. We do have another question here. I want to make sure from Lorianne, where can we get a patch test? It really depends where you are. If you're in the United States, you can go to contactderm.org, enter your zip code, and you can find a patch testing doctor in your
Very
area.
good. Excellent.
Allergists are also good stops for patch testing. In the Philippines, it would be the Philippine Dermatological Society. In your country, you can go to your official dermatological society, ask for contact dermatitis specialists, and they would probably be the most likely to offer patch testing.
Right. And in the Philippines, we have an contact
At the
dermatitis
clinic.
group
Yeah.
of the Philippine Dermatological Society as
Right.
well.
Okay, it is 10:56. I know you have patience and
Oh my
research.
God, that flew.
Too bad.
That
I
was
will
quick.
stick around to do a quick summary and some other stuff, but I love
Thank
you.
you.
Mwah. Thank you so much. Oh my gosh, we have such exciting things to talk about in the future.
What was that?
I don't know.
That was a boy. That was
Okay.
a boy.
All right.
It was fun talking with you. So stay safe. COVID is still here and growing, it seems, in certain areas of the world, and mutating perhaps and doing its own craziness. But stay put and healthy.
Okay. Thank you. Bye. All right. So, very quickly in closing, do you want to sit and join me, babe?
Are you going to join?
I just finished.
There you go. So you can hang
Wonderful.
out with me. So, okay.
That was very tiring.
In summary,
This is my grandson.
yeah.
My favorite grandson. Mwah.
Oh my God.
I would hope.
I would hope. Okay. So there's a lot to cover, but I think, if I were to summarize sort of the more important take homes here, right? There are so many different types of skin reactions that honestly, it's not something to sort of play around with. Talk to your esthetician, talk to your doctor, just to rule out, especially if something seems very extreme, is very hurtful, is very itchy, is spreading, etc. Chances are for skin, most of the time it'll be an allergic reaction or an irritant reaction. Acne is not a reaction. It is evolved and built up over time. It might be an acneiform reaction, but chances are you're not going to get that type 1 mega sort of urticarial scary reaction. And if you do, then definitely, seek help. Okay, so very quickly again, we've got the Everything special at vmvhypoallergenics.com. We have launched Route, so you can have insurance for lost or stolen packages, which is really
Oh, you
cool. You do. In the Philippines, we have specials on these puppies, the lip glosses and the lipsticks at boutiques and online.
Wait, let me show.
And we have 40% off facials too in boutiques in the Philippines. And then at the clinic, you have it's a special price on 2 super washes, the Monolaurin pellets, and the Know It oil, all of which are awesome for staying safe in the pandemic. If you have had a patch test, you can contact us and we can help customize recommendations for you. If you would like, what was I going to say? I mentioned the patch tests. Oh, right. If you'd like a teleconsultation with my mother or other doctors or nutritionists we work with.
Please PM us or DM us. Just
Exactly.
private message.
Okay, so our gift for our Skintastic viewers today, you get $10 off when you shop online with this code, VMVSkin101. They're limited redemptions. It's first come, first serve, and it's valid for the next 24 hours.
Can we type
they
it?
will type it in, not to worry. VMV Skin 101. Join us in the next live stream. Jenna, I like that idea. I'm going to really look into the gastrointestinal relationships. We were going to get into a bunch of things. I love the ideas. Thank you very, very much. And yeah, let us know. Any other questions that pop up here, I'm still going to check back myself to make sure that I get answers for you. And
can we type it just to make sure that?
Gavin would like to type the code.
Yeah. Where is it?
There.
Okay. So
So he's going to be typing as I say goodbye.
Whoops.
There, see?
It's very hard to see it.
This is what you call a very professional high level
Like that,
yeah.
and then
High level of production is what we're doing here. But anyway, I want to say thank you very much for watching and for all your questions. This flew by. It's a very complex topic. I think we should do another one and maybe concentrate on certain things because it's wild. Ooh, and the maskne idea, the update on acne and maskne, that's funky, not your typical stuff, but like the mites and the really weird or different bacteria that's super unexpected. So thank you again. Have a wonderful
Have a
evening for those of
wonderful-
you in that time zone.
and have a wonderful day for those of you in the Philippines.
Right, or this time zone.
Yeah.
Bye everyone. Thank you,
Bye.
thank you.
Okay, so end live video in 3, 2, 1. Bye. Wait.